Turning now to some morning medical news. A new study linking abortion bans to higher infant deaths. States with bans saw a 6% rise in newborn deaths, particularly among babies with severe birth defects. Researchers say more women are now carrying pregnancies to term despite terminal diagnoses. Another new study revealing veterinarians are being exposed to bird flu even when they haven't treated infected animals. The research, delayed by last month's Trump administration federal communications pause, shows unexpected exposure through blood testing. Of 68 human bird flu cases since 2024, only 3 people had no known contact with animals. And we are continuing to cover the most intense flu season the U.S. has seen in 15 years. That is according to the latest data, showing that there have been around 13,000 deaths related to the flu, including at least 57 kids who've died. Mandy Gaither speaks with a doctor about the flu symptom red flags that should send you straight to the emergency room.
This flu season continues to worsen. Cases, hospitalizations, and deaths are all trending up, according to CDC data.
This is the most severe season that we've seen in terms of numbers of cases in about 15 years.
Dr. Daniel Kariskis with Brigham and Women's Hospital says symptoms of flu can include high fever, muscle aches, body pain, and headache. But he says if red flags are present, like a persistently high fever, shortness of breath, or difficulty breathing, it's time to get emergency help, as it may mean pneumonia is developing.
We don't think that the cases themselves are more severe, or that this strain is causing worse flu than in a typical season. It's just so much more frequent.
Kariskis says those at highest risk of getting severely sick are seniors and those with some pre-existing medical conditions like heart disease and lung disease. While flu cases typically peak in February, he says it's still not too late to get protection through vaccination.
Even if you've had flu earlier in the season, you should still get vaccinated because there are 2 different types of flu that can circulate, and having one type doesn't protect you against the other. So get vaccinated if you haven't been.
You can also help stop the spread of the virus by keeping your hands and frequently touched surfaces clean, avoiding close contact with those who are sick, and not touching your eyes, nose, or mouth. And new this respiratory virus season, there is an at-home test that can help you determine whether you have the flu or COVID.